A new warning for parents: feeding your newborn solid foods could lead to future health issues. A study conducted by the CDC shows more than half of parents introduce solid foods to their babies too soon. Researchers found these kids are much more likely to be overweight and develop diabetes. At the same time, babies who start eating solids too late are at a greater risk for nutrient deficiencies. Pediatricians say the best time to introduce babies to solid foods is between 6 and 7 months.
And did you know Medi-Cal has a dental program, appropriately enough, called Dent-A-Cal? This year, adults enrolled in it are eligible for expanded benefits.
And here to explain is Dr. John Luther, the Chief Clinical Officer for Western Dental. Thanks so much for joining us. Appreciate that. So Dent-A-Cal has not been funded since 2009. Why the change this year?
So Dent-A-Cal was funded in 2009 for emergency benefits only. So the great news is that this year, benefits were totally restored for adults. And we're talking about 8 million Californians that now have dental coverage under Medi-Cal.
That's great. And so what does that mean in terms of coverage? What can people now get that they couldn't get before?
So what that means is that patients can now get more of what they need and not just what they can afford. So some of those things that they can get now are white crowns on their front teeth. They can get root canals on their back teeth instead of just having those teeth pulled. They can get partial dentures instead of full dentures in case they just are missing a few teeth. And very importantly, they can get gum care.
Wow. That's very important for
Yes.
overall health, too.
Yes.
I guess the preventative dentistry is beneficial in the long term, saving you money, don't you think?
Yes. Oh, absolutely. So, for example, we know that diabetics who have gum disease cannot control their blood sugar. And there are links with periodontal disease and other chronic diseases like heart disease, stroke, and so forth. So to be really healthy, we have to have good oral health as well.
Yeah, as someone who avoids the dentist, I hear it all the time. I've got to go in for 4 fillings next week.
Yeah.
Not looking forward to that. But let's talk about for dentists on your side of things. How does this change? I know a lot of times there are insurance discussions in doctor's office
Sure.
and dentist's office.
Yeah.
Does this make your life easier, or does this put a little more paperwork on your desk?
No, I think this is really a positive change for Californians on Medicaid. We have about 190 offices that where we serve Medicaid patients, and we have been doing that for 50 years. But what this means is the patients coming in can now get what they truly need. So this is so important for their oral health and overall health. And what we're hoping is that more dentists in the state will now start seeing these patients and they can find the care they need.
And they just need to sign up from your website or something like that?
Yes, they do.
Very good. And does this include just the major little checkups, every 6-month checkup that?
Yeah, so it's really important that people go in for regular checkups. So if you go in for regular care, you keep things simple.
Yeah.
Your teeth stay beautiful. Preventive visits are very easy. People get in trouble when they avoid going to the dentist, and that's when they end up in emergency rooms or have very expensive treatment.
Yeah, it's so important too. I mean, your teeth are a lot to a lot of people.
Yeah,
it's not
certainly.
just aesthetics all the time, but when you have a toothache,
Oh, yeah,
it,
you feel it.
affects everything you do.
Yeah.
It affects everything you do. People with poor oral care can't have good nutrition. Many people without their front teeth have difficulty getting jobs.
Yeah.
So it affects all phases of our lives, and I really encourage people to use the benefits that they now have and go in and get the care they need.
Well, Dr. Luther, thank you so much for joining us.
You're welcome.
And if you're at home want more information on Dent-A-Cal, you can go to their website. That is denta-cal.ca.gov. I always have trouble when they put the little dashes there. Denta-cal.ca.gov.
ca.gov.
Okay, there you go. ca.gov.
Thanks
Thank you so much.
for coming
Thank you.
in.